Hi everyone, my name is Diya Laha. I'm a first year student in the Faculty of Science at the University of Calgary, and I'm so excited to share with you my research from this past summer. My research poses the question of what influences the quality of electronic medical record documentation in hospitals. Before beginning my first year at the University of Calgary, I was lucky enough to conduct research at the Cummings School of Medicine under the Center of Health Informatics. The basis of my project focuses on precision medicine, which is essentially an approach that focuses on matching the right patients to the right medicines at the right time, ensuring the best quality of healthcare and top accuracy. An important field in precision medicine is medical documentation. Within the past 20 years, there has been a rise in electronic medical records over paper records within hospitals. The quality of electronic medical records in hospitals is important for accurate, consistent, and thorough information on which to base patient care. In order to improve electronic medical record data quality and/or clinical communications, a full understanding of the influences on writing style and documentation content is required. My objective with my research was to understand the potential biases and influences on electronic medical record documentation in hospitals. For my methods, I completed a systematic review of literature from the years 2000 to 2024. My search began quite broadly, then I decided to narrow my search to focus primarily on clinical documentation. I included keywords such as electronic health records or electronic medical records, and influences or factors, and quality. I utilized the database Medline for my search. Majority of the studies were focused on literature and not healthcare, so I narrowed the search down to focus on influences on electronic medical record documentation and was left with 131 studies relevant to my topic. From my full-text review, I compiled the particular influences and factors on electronic medical record documentation quality and organized them to a word cloud as shown here. The visually larger words appeared more frequently in the studies. Key themes I collected from my results can be divided into two sections: personal factors and environmental factors. Personal factors that had an influence on electronic medical record documentation quality include racial bias, stigmatizing language, level of education or experience, so for example, medical school students versus physicians, and clinical reasoning. There has also been found to have patterns of documentation between male and female clinicians, as well as an increased conscious effort to document more detail when patients were at a higher risk or when patients had access to the records. Environmental factors that influence electronic medical record documentation included computer access, time given to document, structure, policies, and challenges using electronic medical records. The negative feedback for the implementation of electronic medical records was common, which resulted in lower quality documentation. Copy and paste was frequently used as a shortcut, impacting the quality of documentation. Overall, personal and environmental factors influence clinical documentation in hospitals. My next steps involve interviewing clinicians to expand on what is known about clinical documentation writing styles and to develop a comprehensive framework for accessing hospital electronic medical record data quality. By studying and working on this project, I learned that there was a lack of focus surrounding the particular influences on electronic medical records. I'd like to share my thanks to my supervisors, Dr. Kathy Eastwood, as well as Dr. Huda Kwan, for their support and guidance throughout this project. I would also like to thank the Center of Health Informatics for providing the space and opportunity to conduct my research. Thank you.